Hey everyone, welcome to another episode of DarshanTalks. I'm your host, Darshan Kulkarni. It's my mission to help patients trust the products they depend on. I'm an attorney, I'm a pharmacist, and I advise companies with FDA-regulated products. So if you have an interest in an FDA-regulated company or its products, this is the podcast for you. So today's podcast, I think, is incredibly special. I think we're going to be talking about super cutting edge things. We're going to be talking about things that are everything from what I refer to as M bands to the idea of net neutrality to cybersecurity to privacy, all from the person who has a massive role in deciding how it was going to play out. So if you are in privacy, if you are in cybersecurity, if you are making decisions at a global level, you probably want to listen to this podcast. So today's guest is an individual who has his own Wikipedia page, and I don't get to say that very often about people. So he was the chairman of the FCC, and from 2017 to Jan 2021. Though I kind of have a hard time trying to figure out whether I should use the word was, because technically there's no other chairman, so he's technically still, I guess, chairman. But you can tell us if otherwise, if you will. He was instrumental in many of the policies that we're now sort of working with. He is a Harvard-trained lawyer. He's worked in the DOJ. He worked with the U.S. Senate Judiciary Committee, and it's an absolute pleasure just to have you on. Thank you again for coming on, Ajit.
Oh, Darshan, it's so nice to be with you. Thanks for having me.
So let's talk a little bit about some of the issues that we've been getting on. So first of all, let me ask the really basic question. Do I get to call you the current chair or the past?
Oh, no, I'm definitely the past chair. I resigned on January 20th and now entered civilian life fully. So, I passed the baton on to one of my former colleagues, the acting chairwoman, Jessica Rosenworcel, and she's doing a great job. So she's at the top of the heap.
Fair enough. Good to know. So it's past chair, clear and simple. So let's talk a little bit about how you decide what issues you want to tackle when you are the chair of the FCC. How do you even decide what your policy rule is going to be? Is it something you decide at the beginning of the term, or is it every year? And how do you sort of reprioritize as you go along?
That's a great question. So at the inception, back in late 2016, early 2017, I sat down with my team and sketched out at a very high level what we wanted our overall policy priorities to be: closing the digital divide, promoting innovation, consumer protection, making internal reforms. And then as the months went on, once I became the chair, we started fleshing out in more detail what those policies were going to be. So, for example, when it came to promoting innovation, advancing 5G and some of the other applications of 5G, like telehealth, we put meat on the bone, so to speak, in terms of making more spectrum available. So it was a very challenging job, but a very rewarding one, because you had a chance to deliver value for the American consumer on a day-by-day, week-by-week, month-by-month, and ultimately year-by-year basis.
So you're talking about providing value to the American consumer, which obviously makes sense because you're operating at that level. I guess my question is there a difference in the way you think about the American consumer versus the American patient? Or is that not necessarily a thought in your head as you're contemplating, if you will?
It definitely was for me. I mean, I grew up the child of two physicians. I'm married to a physician as well. So, certainly, whether I like it or not, I didn't go to medical school, but at least as a patient, I can appreciate the work that they do. But more seriously, given the vantage point that I had at the Federal Communications Commission, the intersection of healthcare and technology was one that I saw almost every single week. And so when it came to telehealth, for example, I took some of our existing programs, like a rural healthcare program, and increased the budget substantially for the first time in a generation. But when it also came to some of the newer programs, like I said, making more spectrum available, or asking Congress for additional authority to boost telehealth services during the pandemic, I tried to think creatively about ways to help patients in need. And to me, that was some of the most rewarding work that we did that helped close the digital divide and promote innovation, was in the sector of healthcare.
Now you talk about the idea of closing the digital divide, and you talk about the work you've done in that context. One of the things that really sticks out to me is this idea of to make that digital divide be closed, if you will, for lack of a better term.
Yeah.
You have to deal with the idea that people are going to have access to the spectrum, and that obviously is difficult and different depending on where you are in the country. I guess what I'm starting to think about is when you're dealing with these individuals across the country, and you're trying to give them access to well, let me make sort of, I tried to contextualize and I lost the context. When you're trying to bridge the digital divide, and you've got to make sure that people have access to the network, how do you make sure that they even have the resources to get there in the context of telehealth? Do you play a role in providing the computers that go along with it? And that would obviously, in the case of COVID, have tremendously helped in the idea of treatment, if you will.
That's a fantastic question. So, yes and no is the answer. We don't the FCC does not have a role in subsidizing or otherwise regulating the devices that consumers would get for things like telehealth, but we did help in terms of providing access to them. So we supported the network, the construction and the operation of the networks that would allow telehealth devices to operate, but we didn't directly have a role in providing patients those tools. And that's one of the things I would love for Congress. I started to urge Congress to think more broadly about telehealth, making sure that we break down some of the barriers, interstate medical licensure and things like that. But one of them I pointed out as well was the fact that these devices might not be affordable. So hopefully that's something that the new FCC, the new administration, and the new Congress will be able to take up.
So when you're dealing with this idea of patients having access to telehealth, and that's obviously becoming a huge issue now around reimbursement and the like, one of the obvious questions that pops up for me, at least, is who has access to the data? And when we start talking about who has access to the data, how big a role does the FCC have in deciding that, and the controls that you're going to have in place around it?
It's a good question. So we don't regulate directly privacy questions. That is the purview of the Federal Trade Commission. But nonetheless, to the extent that we are providing funding to help essentially finance the construction of broadband networks that are used by hospitals and other healthcare facilities, one of the things that we've always emphasized is that we want to make sure that these networks are secure in and of themselves. So yes, typically these are dual purpose networks that are used for healthcare and residential broadband, for example. We want to make sure that they're using secure equipment, so not untrusted vendors such as Huawei or ZTE, for example. But secondly, to the extent that we can, we always talk to some of the telehealth providers about the importance of privacy, that as all of this data migrates essentially to a virtual network as opposed to the physical network, physical world, we want to make sure that those principles that underlie HIPAA and other types of protections like that are maintained. And by and large, at least, we found that most of the applications and services are consistent with HIPAA and those restrictions. But it's an ever more challenging situation because it was, especially in an environment like 5G, where IoT or Internet of Things is all over the place. How do you ensure that every single device that is used by a patient or a healthcare provider is secure? That's going to be a challenge because there's so many different attack vectors, as the cybersecurity folks say,
Right.
that bad actors could use.
So that is exactly the question. So you talked a little bit about the means of production. You talk about the fact that certain vendors are more problematic, shall we say, from a national security standpoint. Does the FCC have a role in helping decide the winners and losers in that state, or is that not as much a role that you guys play?
I think our role, at least as I conceived it when I was in office, was for us to ensure to the maximum extent possible that we were doing everything we could to secure the integrity and security of our communications networks and of the supply chain that went into those networks. So that's the equipment and services that were procured, that were distributed in the United States and ultimately incorporated into these networks. And so for the first time in FCC history, for example, in a unanimous vote, the FCC decided to prohibit funds that are distributed by the agency from being used by telecom carriers or others on insecure equipment. And it seems like a very elementary step, but believe it or not, before that, we essentially distributed the money and said to the recipients, typically telephone companies or healthcare facilities or whatever, spend it on whatever you want. We'll leave it to you to decide. But I think we've emerged into an environment where we simply can't take a risk like that and hope for the best. And similarly, when it comes to security issues, I was very proactive in working with my colleagues around the world, my counterparts in Brazil and India and other places like that, to help develop a risk-based framework for understanding cybersecurity, especially as it relates to individual privacy. And those are the types of things that are now resulting in very strong statements by other countries that they see things the way the United States is, and they're moving to a risk-based framework as well. So I think that's going to benefit patients, not just in the US, but the world around in the time to come.
So that's a really interesting sort of discussion to get into, right? The big discussion is around the role of privacy, and for the most part, we've dealt with this idea that privacy is generally controlled by HIPAA in the U.S. You've got the FCC Act as well. In Europe, you've got GDPR. People are talking about a more national framework, a more federal framework. I guess my question to you is, how would a national framework around privacy change the way you would have operated? Because I assume that at the FCC level, you're going and doing it at a state-by-state level in addition to a national level. How would that change how you operate in the future if you had the opportunity?
Well, certainly, I think there is a bipartisan desire in Washington to create a federal privacy framework, because right now, as you pointed out, we have state-by-state regulation, in particular California, which has a more forward, more active privacy framework, and GDPR from Europe. And so some of the companies that operate across state lines in the United States have said, look, we can't have this patchwork domestically and internationally. We need a single consistent level of regulation coming from Washington. And this is something that I've seen consistently, not just for privacy, but on all kinds of different issues, that increasingly these communications networks traverse state lines. And so I think the Congress should sit down and put on the page some basic principles for privacy protection, network management, and things like that, so that any technology that's based on IP, the Internet Protocol, is governed in a simple, consistent, and coherent way. I don't think we can go on much longer like this with every state or country taking a bite at the regulatory apple, so to speak.
And that's really what gets to us, right? In the context of GDPR, we lost the U.S. data shield because of the idea that we don't have a federal standard that we can apply to. On the other hand, I find it interesting that I understand countries like China and the like do have the data shield. So the question is, what we have to do right now is on a company by company basis demonstrate that we have controls in place, and therefore we can process EU data. And that gets into the issue of cybersecurity as well. So how do you, at an FCC level, enable American companies to contribute and to operate at a global stage when you've got these privacy issues kicking in around patient data, especially in the case of, say, pharma or medical device companies who are hoping to basically be able to transmit information, do research across the globe, and bring it all together for the American consumer, for the American patient?
That's a great question. For better or worse, the discussions around the Privacy Shield were centered more through the Federal Trade Commission, the FTC. And so I think that's one of the things that they've been trying to sort out is how do we demonstrate to the satisfaction of American consumers and also the constituents abroad, such as the Europeans who are interested in seeing the strength of privacy protections. How do we demonstrate that we have sufficient sufficient privacy regulations here in the United States? And that's a big challenge, I think, for them under current law. I mean, certainly, I think a federal framework established by Congress would be superior, and that's something that everyone can understand, and that reflects the current understanding of elected officials. So I would hope that at some point Congress passes that legislation one way or the other.
So let's talk about operating at a global level and controlling the means of production. And what I'm referring to is this idea that we're becoming more and more concerned about global actors. How do you hinted at this a few seconds ago? Do you have any kind of initial thoughts about how companies should operate so that they don't risk data from individual patients going into national actors in other countries?
Definitely. I think especially for those in the communications network space, it is vital to ensure that that you are relying on a supply chain with integrity. And while it might seem tempting to simply pick the lowest cost provider, given the fact that you've got profit and loss statements you have to worry about, and you're ultimately worried about the bottom line, I think the long run interest for your company and of course for the country is to ensure that you have a secure network, and that one that respects your customers' privacy. And that's a part of the concern that we had at the FCC when I was in office, was that a lot of the Chinese vendors in particular were lowest cost because they were subsidized in many cases by the Chinese government. But the long-term risks in terms of security and even in terms of cost, because they had long-term lock-in contracts, ultimately would not be to the benefit of some of these customers. So one of the things I would encourage anybody in the healthcare technology space to think about is to ensure that you're not just delivering a better widget, so to speak, that gives your customers, gives your patients better services, but also one that you can say with confidence will be more secure. Because ultimately, if that data isn't secure, then I think you're opening up a can of worms that's going to be worse for you, worse for everybody in the healthcare ecosystem.
So that raises the question of the competing interests of security, privacy against cost. Do you think, from your vantage point, patients and consumers care about privacy and security as much as they probably should? Because that definition has been changing over time.
Yeah, that's a good question. So I think it depends on a number of different factors. One of them might be age, for example. And I know this is something that's talked about generally in the press and on social media and whatnot, but I've often been interested to see how people who tend to be more protective of their privacy, whereas those who are younger will share virtually everything as long as they perceive that there's a trade-off for that. They get better services or free services and the like. And so I think when it comes to healthcare, generally speaking, of course, I think there's more of a tendency among the young, who are of course earlier adopters of technology, to be willing to share information. And they're different. I think you see a lot of exceptions to that rule, perhaps, when there's an example of somebody tracking your location based on your cell phone, for instance. And that's not something the FCC have been investigating when I was in office. But I think generally speaking, people understand that in the internet economy, to the extent you share data, you're more likely to get things in return. And young consumers tend to be more comfortable with that. But it also depends by country, too. I know Germany, for example, consumers tend to be much more resistant to sharing data just for cultural reasons than they might be in the United States.
It's funny you mentioned countries, because one of the things I'm thinking of is the exact opposite situation, where the Indian privacy law contemplates the idea that no, all your data belongs to us, and we'll decide. Basically, this data just cannot belong to anyone else. It'll stay in India, while other data can leave. If you ran the U.S., which in many ways you kind of did, but ignoring that part of it, is that too much power from your perspective for individuals to have, or for the government to have? Or do you think that India is drawing the right balance, if you will? Are you aware of the law I'm thinking of when I pointed to it, by the way?
Yeah, that's a great question. And I unfortunately, I don't have the answer to that. I mean, I can see the emotional appeal to both sides of the argument. On one hand, to the extent the individual owns, however you conceive that concept, his or her data in its entirety, that's very appealing, right? Because that data obviously springs from things I do or say, or where I go and whatnot. But on the other hand, I mean, if I'm walking down a city street, for example, and a city has a smart city network in place, it also has an interest in my data to the extent that it needs to monitor me to make sure that I'm walking through an area that's safe, or that they need to light up lamps. And so, what is my data in that situation? It's very difficult to kind of draw the line. And so that's one that I'm very torn on. And I'm glad I don't have to be in elective office having to craft legislation to address that situation, because it's just what data is no longer clearly attributable to an individual, I think, in the modern era.
Which really raises the interesting perspective that we had with Israel, for example, and COVID. And they took, they basically said that we've collected all this data around our people with COVID. We're quote unquote the startup nation. We're willing to use this data to help other companies succeed. You're transitioning more into a private life from public service, and guiding companies. Do you now have a different perspective on on the appropriate use of public data for private purposes?
I do, and so I think that this might not be consistent with the overall view of many Americans, but I tend to think that to the extent that data can be essentially anonymized, that we can remove any personally identifiable information, that we should make to the maximum extent feasible all of this information for data scientists and others to analyze. And I think especially as artificial intelligence and machine learning start to become more a part of the healthcare ecosystem, it's going to be vital for us to feed those algorithms as much data as possible so that we can make more informed decisions. And this is something that has not just individual or even facility by facility significance, it has national significance. So for example, I was talking to an entrepreneur, a global entrepreneur. He invests in AI and machine learning companies around the world. And he said that he's directing the vast majority of his investments now to China. And when I asked him why, he said that because number one, they have a huge embedded base of 1.4 billion citizens. So that's a start. But secondly, and more importantly, that to the extent that the Chinese government doesn't want data to be used to threaten the government, obviously, but short of that, they don't really care how the data is used, as he thought of it anyway.
Yeah.
And so he said that companies could use that data to really decide, okay, here are different applications and services that really might be worthwhile pursuing. Whereas in the United States and Europe, as he saw it, they were much more restrictive about the use of that data, even though it was anonymized. And so, I think that's one of the things that Israel and other countries are doing that is very interesting is, let's learn some lessons from COVID in the terms of the aggregation of this data and use of it. And maybe that's a harbinger of the future. That's a way we should think about it, because I think I don't want there to be a tension between privacy protection and the development of AI and machine learning in the United States or companies or countries that are aligned with the United States. That would essentially be ceding AI and machine learning to other countries and regions, and we certainly don't want to encourage that.
Great question, which is at a national security level, the idea that the moment you give up control, the moment you say that we're going to control the data so much, other countries are going to fill in that gap, and I think that's fascinating. Last question, because we're already running close to the time on these issues. One of the things you're most famous for is this idea of net neutrality and how that plays itself out. I guess my question for you is, from your vantage point, could you talk a little bit about your thought process around net neutrality and how it implicates health and how it implicates medical device production, if you will, and telemedicine?
Definitely. So with respect to the issue itself, what we did in 2017 when I was chairman was to simply restore the bipartisan framework that governed the internet from the commercialization of the internet in the mid-1990s until 2015. Starting the Clinton administration, for example, the FCC decided that it would not regulate the internet like a slow-moving utility like Ma Bell, AT&T back in the 1930s. Instead, it would take a more market-based approach and let the marketplace develop organically. And as a result of that decision in the 1990s, we saw $1.5 trillion in network investment. Companies like Facebook and Google and Amazon grow up from startups to become global giants, and consumers benefited, of course, from all that online innovation. That's the framework that we decided to reaffirm in 2017, and the results since then have been strongly positive. We've seen infrastructure investment go up, setting fiber deployment records in 2018 and 2019. Speeds are up as of today over 100% compared to what they were in December of 2017, and consumers still benefit from an open internet. So the other issue is how does it affect healthcare? And as you pointed out, and to me at least, I think you have to have the market-based framework as opposed to the strict net neutrality regulations to really help telehealth pop. For example, one of the core principles of net neutrality advocates is that every packet on the internet should be treated the same. You shouldn't speed some up or slow them down or prioritize anything. But to me, at least, if I'm benefiting from remote surgery or something like that, I definitely want that to be prioritized over someone checking email or watching cat videos on YouTube. Or you want to encourage networks of the future, especially 5G networks, to be optimized for use cases. And I can't think of a more optimizable use case than telehealth and connected care solutions. So the ability to change how we think about packets is critical, and you can't do that with strict net neutrality. And we saw this in California recently, which passed a very strict net neutrality law banning, among other things, zero rating. And the Veterans Affairs Department under the Biden administration said, taking the law at its terms, this means that we can't allow veterans to benefit from free healthcare apps delivered over wireless networks, because that would be prioritizing healthcare apps over other apps. And so some of the wireless carriers stopped that service. So that's the kind of thing we want to make sure that every consumer is protected, of course, with an open internet, and we want to make sure that we can promote innovation. So to me, at least, that light touch framework we restored is exactly the right one for consumers and for patients as consumers.
As you were deciding that you were working in a certain framework and certain sets of facts, what sets of facts, in your perspective, change our tipping point to go, what, we need to regulate it as a public utility? How does that? What are some factors that may change that tipping point for you?
I mean, to me, at least, always for this issue or any other issue, the most compelling case for FCC regulation is market failure. Is there a fundamentally broken market where the free market just doesn't work and the government needs to step in? To me, that is not the broadband marketplace. I mean, you see all kinds of companies in the wireless market alone. I mean, AT&T, Verizon, T-Mobile, smaller carriers like US Cellular and others looking to compete. And you see also entry into the broadband marketplace on the fixed side. So, for example, when I was in office, we approved the application of companies like SpaceX to deliver broadband from space. We made more spectrum available for fixed wireless providers to use unlicensed spectrum to deliver value. We encouraged electric utilities to get into business, and many of them are doing that. So this is not a marketplace where there's just a natural monopoly that's fundamentally, that you can only have one provider, and it's going to be a company like AT&T was in the 20s. So to me, at least, utility style regulation would be the worst thing when you want to incentivize competitive entry and investment.
So I'm trying to sort of pull what you said together. What I'm hearing you say, what I'm hearing you say is, if you saw a tremendous amount of mergers and acquisitions that really started limiting competition, that's when you see a potential value in the government coming in and saying we need to control this differently. But right now, your perspective is that we don't have that. We have tremendous competition already, and that's only growing. So that the role of government is limited government, and therefore let it keep going the way it is for right now.
Yeah, I think that's basically right. And another aspect of it as well is, if you think about what it means to regulate something like a utility, the internet is essential to our daily lives. I think the pandemic has ended any debate about whether it's a luxury or a necessity. I think it's a necessity. Right. But when it comes to the question of how do you regulate that, to me, the internet is not like the water company. It's not like the electric company. You don't think of water companies or electric utilities being all that innovative. They don't. For example, there's generally stable usage over time. They're not introducing a lot of new products and services. The internet is by far much more dynamic than that. And so you need to be able to scale infrastructure over time to accommodate all of these different use cases on the internet. And you can't do that if you're simply regulating everything like the slow-moving utility that Ma Bell was back in the 1900s, and the 1920s and 30s. So to me, at least, to enable companies like SpaceX and fixed wireless providers and electric utilities and others to make these investments, you have to give them a market incentive to do that. And if the FCC is saying, okay, we're going to fly spec your network management practices, how you raise capital, how you operate services and whatnot, you're never going to incentivize companies to take those risks, to raise that capital, and to build those networks of the future.
Very, very cool. So Ajit, we ended up speaking a lot about a variety of things, everything from the changing definition of privacy to cybersecurity to controlling the means of production across the globe. We talked about net neutrality, as we just mentioned. Is there anything I missed? Did I miss anything?
Oh, I can't think of anything in particular. No, we've covered the water. Yeah, telehealth, 5G, neutrality. Yeah, it's a pretty broad waterfront, but I think I'm very excited about the future of healthcare and technology. I think we're only scratching the surface, and especially if we can make broadband ubiquitous in the United States, I'm so excited to see where things go. It's going to be an exciting time for the American patient and healthcare provider alike.
I do have a question that I just realized that I probably should ask since you're talking about you're the guy to talk to around broadband control. One of the big areas that will become big, whether you're talking IoT or the like, but an area separate from IoT is VR. And when you're talking about VR, you're talking about massive use of spectrum. Especially if you're talking about collaborative environments. My question for you is there spectrum for that available? Will that have to dramatically change how we work in the future as VR becomes more and more commonplace?
Funny you should mention that. So I'm a big fan of augmented reality, virtual reality, and where that might take us. And obviously, we can't see with precision what the future is going to be, but we do know that one of the critical bottlenecks for AR and VR, because it's a high bandwidth service that's typically relying on spectrum, is the spectrum itself. So when I was the chair, we made available the entire 6 gigahertz band. This is a huge 1,200 megahertz wide band solely for unlicensed uses, such as Wi-Fi. And you can use any of that band, 160 or 320 megahertz wide channels within that band for gigabit Wi-Fi with relatively very high throughput and relatively low latency. And that is critical to allow AR and VR to be able to thrive. And so I'm really excited about what that's going to mean for the American entrepreneur going forward, that's trying to come up with the next great AR VR solution. I mean, here too, we're only scratching the surface. It could be telehealth or gaming, whatever it is. And we know it's going to be exciting. The FCC has put in place the building blocks for that innovation to happen.
That is so cool. The thing that goes along with AR VR is what I would think of as low spectrum requirements, but critical is this idea of drones and delivery of medicines using drones. Amazon's been talking about doing that, and a variety of different companies are talking about doing that. Is the FCC looking at ways to sort of enable that? Obviously, there are a variety of other agencies that are involved in the process, but from a spectrum perspective, is that something that you looked at, or was it just not a high enough priority at that moment?
So typically the drone issues were handled by the FAA and the Department of Commerce, because the Department of Commerce has jurisdiction over a variety of different, over essentially government-held spectrum. And so they were exploring more how should we regulate drones, and including the spectrum issues there. But to the extent that so we did work with some of the drone companies to make sure that there would be sufficient commercial spectrum available. But right now we're still in the early stages of that from an FCC perspective. But to me, it's just a matter of time. It's such an efficient way to distribute these goods and services, and it's going to be strange 20 years looking around and seeing all these things flying.
I think that's very much going to be the case, and it worries me a little bit just seeing a darkening cloud of drones coming towards you. But I think that was actually the basis of one of the movies. I think White House Down or something like that. That was one of the movies that used the idea of drones as attacking. But I just think it's fascinating. Ajit, this was wonderful to have you on. Thank you so much. I know you're looking at new options, new opportunities. So I'm not going to ask what do you do next, because you're still figuring that things out. Is there a way for people to reach out to you if people have questions about what we spoke about?
Definitely. People can always find me on Twitter. I'm at Ajit Pai, AJITPAI. And would love to continue the conversation for folks who are listening. Thanks so much for having me on.
Thank you for coming on. I appreciate it. Love to have you back again.
Sounds great.